The speaker of this session is Dr. Tara Rajendran. Dr. Tara Rajendran is a PhD student in the Music, Faculty of Fine Arts, Department of Music, Annamalai University, Tamil Nadu, India. Welcome, Dr. Tara. So pleased to be here at AIIMS Jammu and AIAPCON 2025. My topic for today is music in palliative medicine, and my focus for today would be in current research and reporting guidelines. Throughout this talk, I'll be mentioning the terms music therapy and music medicine. So it's very important to have a distinction between these two terms. Music therapy, as defined by the American Music Therapy Association, AMTA, is the clinical and evidence-based use of music interventions, meaning whenever you provide a particular musical intervention to a patient, that has to be backed by evidences from multiple randomized controlled trials. The second one is it has to accomplish individualized goals, meaning it's not like one thing for like a large number of people. It has to be very patient-centric and customized and tailored. Then it has to be within a therapeutic relationship. And then the final one and the most important one, it has to be done by a credentialed professional who completed a music therapy degree program from a national medical regulatory body approved music therapy program, which is in place in many countries, including the US or the UK, and a couple of other countries. But unfortunately, including India and many other lower and middle income countries who have this large repertoire of musical culture, lacks a professional music therapy training program, and hence leading to the lack of NMC accredited music therapists in the country. So we will not use the term music therapy here in an Indian setting, but we'll use music medicine, which is providing pre-recorded music to patients, which is offered by a medical professional, doctor, nurse, social worker, anyone. These are some pictures I've taken from a couple of websites, including the Johns Hopkins website and the NMTA Academy. So you can see these are the pictures of music therapy, or so whenever I use music therapy, this is something I'm using these terms from the places where there is already music therapy instituted as a professional organization. So now here you can see, like, it's not just listening to music, but you can see this music therapist is like on the bedside encouraging the patient to play a musical instrument. Here on this right-hand side, you can see the music therapist is encouraging the patient to play a particular musical rhythmic instrument. Now, the point with this is in neurological music therapy, for instance, I would take stroke rehabilitation. So patients are encouraged to listen to a particular rhythm, and they are entrained to a particular rhythm. And for instance, in stroke rehabilitation particularly, the patient would have an affected limb, an arm or a feet. So the music therapist would encourage the patient to get entrained to a rhythm and encourage them to move that affected limb. And on course of like weeks, it would have some kind of positive benefit on it. This is again from the National Endowment for Arts and American Music Therapy Association. So what they're trying to say is that the current evidence that they have done using randomized control trials, hundreds of them, is that they found that music would have an impact in depression, pain, and anxiety. Now, in the method section, you can see that, again, as I said earlier, this is not just listening to music, but see the first one, improvisation. Like they would give a particular music, like a popular music, and then encourage them to involve and engage in that particular music by improvising that music. And then songwriting, group drumming. This is one of those times where it's not personalized. It's like a group project, group drumming, structured music listening, music to refocus attention, music lyric discussion. So imagine the potential that we have in India, or the resources that we have in India for this particular like music lyric discussion, like Bollywood, Gulzar Saab's music or Javed Saab's music. Imagine the kind of potential. People would be happy to engage in these kind of discussions. Then there is singing and chanting. Again, another potential resource where India has a lot of resources here. Then instrument playing an instrument. So that's a little tricky place because there should be some amount of institutional grants and support in place to have that amount of musical instruments in place. Now, when coming to palliative care particularly, there are hundreds of randomized control trials, and the meta-analysis on these randomized control trials have shown a positive impact in 4 major domains: pain, quality of life, psychological well-being, and physical symptom distress. I'm not going into the details of those studies, but if anyone's interested, I'm happy to give out the list of publications, and also it's provided in the footnote. Now, coming to how music is actually impacting these 4 domains. One is music prevents the hypothalamic pituitary axis activation. Now, what it does is that when somebody or a patient listens to relaxing music, when I say relaxing music to them, because one particular music, oh, amazing, like it's so calming. It's calming to you. It might not be calming to someone else. It might trigger some memory, some core memory for them. So it's important to ask what's relaxing music for them and then play that. So when you do that, the cortisol level, the stress hormone, is lowering, and also music also impacts the autonomic nervous system and thereby reducing the cardiovascular responses such as pulse rate, respiratory rate, blood pressure. Now, when the patient listens to something that triggers them, or an exciting music like a rock music, so in that case, it also goes in the reverse mode. Now, a 2023 study on mice. So what they found was that mice, so they provided mice with chronic, unpredictable, mild stress during the day, throughout the day. Okay, and in the night, music was provided. So what they found was that music completely prevented stress-induced depression and anxiety-like behaviors in those mice. And then listening to music also restored the serum cortisol level in the during the daytime, during those stress period, the serum corticosterone was high, but in the night, listening to music, cortisol levels were restored. Now, the other thing was restoration of the BDNF, brain-derived neurotrophic factor, and BCL levels, BCL2 levels. So, cortisol, the stress hormone, decreases the BDNF expression in hippocampus, but this particular study saw that music kind of restores the BDNF and BCL2 levels. Music also prevented oxidative stress in serum and PFC, prefrontal cortex, and hippocampus. Now, again, like I'm going a little fast because of the lack of time, but I have given the articles in footnote. I'm happy to send the PDF of these studies as well to those who are interested. This one is kind of a path-breaking study that came out in 2022, published in the prestigious Science journal. Up until now, we kind of believe that sound and music, for instance, it kind of impacts or have this positive impact on pain. It's because as a subsidiary from how the music reduces anxiety, as I said, stress and all of that, stress reduction and all of that. But this 2022 study says that it's not a subsidiary thing. Like pain reduction from sound is not a subsidiary thing, but sound-induced analgesia is a direct analgesic impact of sound on mice. So this is a mice study again. So what I'm trying to say is the research in this field is an expanding avenue. We are still learning things. We still are exploring things. So from this picture, you can see like a light red arrow here and the blue arrows. See, these are the things that we already know. So you can see, like from the mice, the sound waves are going to the auditory cortex. And in the other picture, on the left-hand side is the pain pathway. Now, these are the things that we already know, these pathways. Now, the red arrow, the dark red arrow is the new pathway this 2022 study identified as a possible circuitry for the sound-induced analgesia. And the other potential pathways are in the dashed red arrows. Coming to what is the current situation of randomized control trials or in terms of research in classical Indian music. So we did a systematic review meta-analysis of randomized control trials on classical Indian music. Unfortunately, we couldn't find a single randomized control trial in Indian classical music from palliative care. But there were most of the studies came from dental anxiety and the dentistry department, and even for them, and a couple of research one from COPD, like that. But even then, pulmonary medicine department. So even among those studies, it was they had poor sample size. They would use like 15 cases or 20 cases without a proper sample size calculation, and it would eventually end up in statistically insignificant results. So poor sample size, very low level of certainty from grade analysis, and also it lacked critical information on music. Now, this is important because now when you are doing a vaccine trial or a drug trial, will you just say, oh, we gave this particular vaccine and okay, this was the result? No, you would say this was the route, this was the components of the vaccine or drug, everything, the chemical composition, everything, right? But and the dose given, all of that. But in music trials, I mean, from the current research that's existing right now, it was just like we gave music and this is the impact. That's it. So many studies even lacked a CTRA registration number. So there were a lot of bias and also lack of critical information on this. Now, why a randomized control trial? Why am I emphasizing on like randomized control trial in music? Obviously, music-based interventions, because I mean, physicians would know that in the hierarchy of medical evidence for an intervention study, randomized control trial is the gold standard research design. It has low bias and strong evidence. The basic skeleton framework of a randomized control trial would be assessing for eligibility, then moving to randomization. There are methods of, like, for instance, block randomization. And then there is allocation concealment. I'll come to that. Now, allocating into intervention. So there is music-based support or music medicine. And the other hand, you can provide. So the problem with these kind of musical interventions is that you can never mask or blind, double-blinded randomized control trials. You can never do that. But the best that you can do is providing music and comparing it with some other genre of music, like comparing two different genres of music, or like Bollywood music or popular music with chanting, or Indian classical music with something of folk music. Or you can do is that patient preferred music versus researcher preferred music. Or you can, again, as I said, verbal based support or like usual care, all of that. And then you provide the intervention for a amount of time, because a lot of studies, like it was like one time for 5 minutes music was provided. So that's not how it's done. For like few weeks, you would provide the intervention and then follow it up and then analyze. Randomization methods. There are a couple of randomization. The reason why I'm focusing on all of this is that it was so, I mean, I was lamenting on how, the lack of critical information also included, there were no mention of how they randomized as well, introducing a lot of bias even in a good study. Allocation concealment, obviously it's important that the people who are aware of the objective of the study should not be involved in the allocation part, so that there should be allocation concealment. This is a basic timeline for RCT. So first you need to design an RCT proposal. You have to design a proposal with a team of physicians, musicians, and biostatisticians from the beginning. Then you have to do a sample size calculation on okay, we cannot just say that 15 patients or something like that. It has to be based on a sample size calculation, because in the end, you don't want to, you do all the work and be like, oh my God, we had, it wasn't statistically significant. Now, ethics committee approval, IEC approval, CTRA registration, informed consent from the patients, randomization, allocation concealment, baseline measurement, whatever that you are going to measure, pain, quality of life, sleep quality, anxiety, any of that. And then do the intervention. Now, I have given it as an example here, a couple of things that you can do from a very amazing randomized control trial that published in 2024 December. Weekly sessions, you can have weekly sessions, and that could be around like 45 to 1 hour, and it could be for like around 6 weeks. This is just an example. You can have like a little more than that or a little less than that. Then post-intervention measurement. And how do you plan these sessions? And there's 45 to 60 minutes, the entirety of the time you need not play music, but rather there should be a lot of communication. So for instance, in session 1, you can just start chatting and connecting with the patient. You can get a list of, patient's favorite music or a raga or language. India is a diverse country. Like in Delhi AIIMS, a patient from Tamil Nadu can come, right? So it's very important to have the language preference, raga, musicians, favorite music, all of that. You need to have a list of the musical preferences. Build a bond with the patient. Assessment of patient's stressors. Can you help me with this? I got some proper. Session 2 is about enhancing the awareness of the impact of music. So, as the patient, how is impacting you? Like, is it having a positive impact? And then session 3 is visualization, or you could use instrumental and vocal improvisations. Session 4 could be review insights gained in the session and develop an individualized music self-care plan. You see, the individualized plan is formed in session 4 after 4 hours, around 4 hours. Now coming to the couple of music, how do you list the musical preferences? There are 2 of these lists, but again, as I said, the kind of research that's happening in the West, most of these preference lists are kind of focused on those musical cultures. But I have prepared one on the classical Indian music, which is put up in the end. Now, before like even going to the proper like music use, details of the music used, couple of basic things that we need to report in when you're preparing a manuscript on music-based intervention is that first, intervention theory. Like, okay, you use this music. Why this particular? You are using Rag Yaman. So why did the researcher provide Rag Yaman? Is it just out of nowhere, or does it have a rationale? And then intervention content. Okay, is it like a bandish, or is it like a kirtanam in Carnatic music? Like, what exactly are you giving? Because the awareness of the researcher on what they are giving, on the intervention they are providing, is very, very crucial. Person selecting the music, is it the patient, is it an independent musician, or is the researcher? All of that. Again, this checklist is available online. I'm happy to give out the list. Music delivery methods, live music, recorded music, intervention materials, intervention strategies. Most importantly, treatment fidelity. Because if you are doing this for 6 sessions, is it, the first session, somebody provided music, is it the same person provided the music in session 3 as well, or session 6 as well? In the first session, music was provided in an isolated room, and in the third session, it was given in an ICU with a lot of beeps around. So it's important to keep the fidelity. Setting is also very, very important, like where you are providing the setting. Again, ICU, like when other noises are there, or isolated room. Can you advance the slide for me? Yeah. This is what we prepare for classical Indian music tradition. If you're using classical Indian music, there were a couple of studies, again, in dental anxiety region, but none in palliative medicine. But it's important, if you are going to plan a study, it's important at proposal writing stage, you need to know, be aware what you're providing, which classical music, like North Indian, Hindustani, or South Indian, Carnatic, name of the ragas, person selecting the choice, and we have a musical grammar on the timings where the ragas can be played. And now scientifically, I don't have any kind of scientific backup for that, but when we check, we'll know. I think that's why we need to do, and even for a subgroup analysis, this is very important. Name of the musical composition, the language used, the meaning of the composition. Like, you are in AIIMS Delhi and you're providing a Carnatic music and the patient is from Meghalaya. So it's important again and again, like the researcher need to know what exactly they are playing, okay, this composition, what exactly does it mean, right? Then, okay, can you advance the slide? Okay. So based on the WHO's health, the previous one, Health Evidence Network Synthesis Report number 67 from November 2019, we kind of engaged in a thought of policy considerations for India. And this is aligned with WHO's report. So to facilitate randomized control trials on classical Indian music through dedicated research institutes, and as well as government funds for integrative medicine, including music-based interventions, facilitate randomized control trials exploring the feasibility, acceptability, and suitability. Because you have the randomized control trials in place. Now, publishing a randomized control trial is just the first step to it. And then instituting that and integrating into a hospital setting is actually where you have to work on. Now, yeah, for that grants are important. Check the feasibility, accessibility, suitability for clinical inculcation, and then constitute a multidisciplinary panel comprising physician musicians and physician musicians to formulate a policy framework aimed at developing music therapy schools across the country with curricula adapted to the diverse regions of music of India that train students in delivering music therapy that is proven through RCTs, uh, music MT board certification and accreditation procedures must be instituted. Then RCT training workshops, because a lot of studies we saw, some are actually very good studies, but they lacked couple of information which are critical. So it's important. That's all. Yeah. Promoting public awareness. Thank you. Thank you. Thank you, Dr. Tara. That was really an extensive session.
Let's begin our Q&A session before we wrap our session. Does anyone has any questions?
Same way with music therapy, as you rightly said, certain people like to listen to that particular slogans or something particularly towards the end of life. They feel energized or they feel more connected spiritually, so that definitely helps. So it is very interesting the amount of evidence based. I think that is what is the more key here, that we are all doing something or the other, all palliative care people. But I think documenting, having it as an evidence base will definitely go a long way, because we can use it at different levels at different people. So that is very important. I think that is what we should learn today. That whatever we are doing, let us document, because many a times we don't. There are so many organizations who come. It need not be a therapy per se, but even if they come play music, because when we have a hospice assisted living facilities, the day we play old numbers and all the elders are like really spiked up, things like that. So I think that is very important.
Wind up the session. I would like to thank the chairperson, Dr. Republica Sridhar, our speakers for the day, and to the audience for your patient listening. I believe every one of us has really enjoyed the session. Thank you so much.
Session participant can have chairperson and speakers.
I would like to request the chairperson and the speakers to come in the front for the group photo.
Light on the.
This one. You also come.
That's okay.